Hello, my name is Dennis Gorman. As I'm sure you all know, we are currently going through a global pandemic. Despite this, however, the current healthcare system would likely lead to 36 million people being uninsured by 2027, according to Dr. and Professor Steffi Woolhandler. Almost everyone is bound to have some medical issue requiring professional intervention within their lives, which they will have to pay a great deal for, especially during this global crisis. See Figure 1. First, I would like to tell you all the costs of health insurance through a personal example. Then I will lead into how the US healthcare system is currently broken. Next, we'll discuss how Medicare for All is a good solution to our current healthcare crisis. And finally, I will leave you with what you can do to contribute to passing a Medicare for All bill. Let's first begin with some of the costs of healthcare from my girlfriend's father, Glenn. Glenn has high-risk diabetes. He has a well-paying job and even a top-tier insurance plan. $500 to $600 every paycheck goes to his health insurance. His insulin costs upwards of $2,500 every 90 days, and he pays over $7,000 out of pocket by summer. He also has an insulin pump that costs $2,000 alone, plus some extra medications costing nearly $3,000 to reduce his blood sugar even further. See Figure 2. Pumps and extra medications aren't necessary, but they increase his quality of life, as otherwise he would have to inject himself with insulin every single meal. If he did not have premium health care, he would easily exceed $10,000 in insulin in 1 year. He may be able to pay for it, but countless people in the United States lack access to health care, leaving them to choose between lifelong debt or their life itself. In fact, type 1 diabetics actually require insulin to survive, and despite its manufacturing cost being relatively low compared to other medications, between 2002 and 2013, according to Hirsch, the insulin prices have increased 3 times as much, and by now it's likely even much higher. So that was my personal experience with healthcare. But let's see how it's broken. The US healthcare system is the costliest in the world. But despite its high costs, our life expectancy has fallen behind other countries, according to Dr. Weisbart. Senator Bernie Sanders and U.S. Representative Pramila Jayapal write, "Before the pandemic, 87 million people were uninsured or underinsured in our country," in an article they published together to The Guardian on May 2nd. Due to job losses from COVID, that number is much higher now. They continue. Over just the last 5 weeks, more than 26 million Americans have lost their jobs. 5 weeks ago, at the time of writing, would have been March 28th, 2020. Very early in the pandemic compared to now. Most of those people who lost their jobs will lose their healthcare as well, as healthcare is most often acquired through an employer just due to its absurd costs. Now that we've gone over how it's broken currently, what is the solution? The solution is Medicare for All. But what is Medicare for All? Medicare for All would provide free healthcare coverage to all citizens in the United States. The government would act as a single payer to pay for most medical costs. In Canada, just north from us, as can be seen in Figure 3, they have a similar universal healthcare system to the proposed Medicare for All bills. On the Canadian government's own website, it states that citizens can apply for public health insurance, which is paid for by their taxes. Private insurance is still available for them for various extended plans. These extended plans could include coverage for prescriptions, dental insurance, paying the cost of ambulance, and even getting prescription eyeglasses. Now let's move on to how it would personally affect you. So, some of the benefits of Medicare for All would be that the government would use private insurance companies to process the bills. So just like Canada, we'd still have private insurance companies, but they wouldn't do quite the same thing. People looking for work would no longer have to consider their place of employment based on whether their employer offers health insurance. Likewise, the employers no longer have to worry about offering health insurance. That should remove a lot of hassle on both sides. There will also be no more massive fees from health insurance companies. See Figure 4. And finally, everyone would have a free choice of your doctor. You could choose whatever doctor you'd like. As for what it would do to the economy, a single-payer system could negotiate with pharmaceutical companies to control the prices of drugs. So, as for the insulin example, Glenn wouldn't have to pay nearly as much for a drug that costs nothing to make. Everyone would pay more in taxes, however, everyone would receive equal care and treatment, no matter how poor or wealthy you are. Now let's move on to concluding thoughts and what you can do to help Medicare for all. So, as we've already gone over, the current U.S. health care system is broken, and implementation of Medicare for all or a similar bill could resolve many of the issues we are currently facing. So, what can you do? First off, vote. See Figure 5. Vote for candidates that support things like universal health care. Email your state representatives and tell them what you support. Email your state senators. Create petitions. Sign petitions. Spread the word. In conclusion, finally, our government funds basic education, a right to education. But our right to life through free healthcare should be guaranteed as well. Because what is education worth to a type 1 diabetic child if his family cannot afford his insulin?